Hello everyone. Today we are going to discuss about the anatomy of scalp, very important topic, and the anatomy of facial muscles. So we are going to discuss these two topics. So first of all, the scalp. So what is scalp? First thing what you must have to remember, that scalp, please remember, it is the covering, the soft tissue covering the vault of the skull. So when it is covering the vault of the skull, it is known as scalp. Now scalp is having the layers, और इसका जो निमोनिक है, the mnemonic is also scalp. तो आपको याद करने में आसानी हो जाएगा. The mnemonic is also scalp. So first of all, the most outer layer, it is the skin. Second, it is found by the dense connective tissue. So dense connective tissue, second layer. Third one, it is the aponeurosis, which is also known as epicranial aponeurosis or gala aponeurotica, which are of the muscles of the occipitofrontalis muscle. L is your loose areolar connective tissue, loose areolar tissue, and P is the periosteum. तो इसकी जो layers हैं, you can understand it by the mnemonic scalp. So first of all, we must have to know these layers. So in this diagram, you can see here that number one, the most outer layer is the skin. So this is the most outer layer of the scalp, that is the skin, and it contains numerous or large amount of hair follicles. So please remember, the skin of the scalp, it not only contains you can say the hair follicles, okay, but it also contains the sweat glands and large number of sebaceous glands. So very important MCQ which you must have to remember, that sebaceous cyst, most commonest site of the sebaceous cyst, it is the scalp. Okay, it is the most commonest site of the sebaceous cyst, it is the scalp. So this is the skin, or the most outer layer of the scalp, that is the skin, the number one layer. Second is your dense connective tissue. Okay, so that dense connective tissue, please remember, in this dense connective tissue, it is shown here by this thing, which is containing the blood vessels. So please remember, all the blood supply, or you can say supply of the scalp, arteries, veins and nerves, it is present in your second layer, that is your dense connective tissue. So it contains what? It contains arteries, it contains veins and nerve fibers also. So all the neurovascular bundle, it is present in the second layer of the scalp, that is your dense connective tissue. Okay, and please remember the third layer is the aponeurosis. So this third layer I am going to show here in blue color. This is your third layer, that is your aponeurosis. So please remember, aponeurosis, that is the third layer of the scalp. Please remember, it consists of the occipitofrontalis muscle. I will show you the diagram also. Occipitofrontalis muscle and the aponeurotic tendon. Okay, it moves the scalps and wrinkles of the forehead. It is formed by this occipitofrontalis muscle. So you can write it like here in this diagram, that on this side it will be the frontal muscle, and on this side it will be the occipital muscle, and then this is the, you can say, aponeurotic tendon, which is this is forming the third layer of the scalp, that is known as the aponeurosis. Now please remember one very important point, that these three layers, 1, 2 and 3, one is the skin, second is your dense connective tissue, third one is your what, aponeurosis. So these three layers, 1, 2 and 3, the first three layers of the scalp, please remember the first three layers of the scalp, they are adhere to each other, they are adhere to each other, and when they are adhere to each other you cannot separate them. So it is also known as surgical layer of the scalp, or it is also known as true scalp. Okay, so it is also known as true scalp or also known as scalp proper. Okay, so it is also known as scalp proper, or it is also known as surgical layer of the scalp. Now please remember this second layer, that is the dense connective tissue, it contains your arteries, veins and nerves. So whenever there is any trauma or any damage here into the to these blood vessels, these blood vessels can rupture and it can lead to severe bleeding in the patient. So please remember this second layer, the very important clinical correlation, it leads to profuse bleeding because of the presence of dense connective tissue here. The vessels cannot done the proper vasoconstriction due to the presence of the dense connective tissue. So if there is any damage here, it can cause profuse bleeding in the patient. Okay, so this is the important correlation of the second layer of the you can say scalp. So if there is any bleeding in the scalp region, you must have to apply pressure to the bone. Otherwise, the bleeding will not be stopped because the vessels cannot vasoconstrict them. Okay. Now the fourth layer, which is a very very important layer, that is known as your loose connective tissue. Here, this one which I am highlighting at the moment in the red color, that is your fourth layer. That is your loose connective tissue. Now this loose connective tissue, please remember, it separates the aponeurotic layer which is present above from the pericranium of the fifth layer, and it is also known as the danger area of the scalp. It is also known as what? Danger area of the scalp. Okay, why it is a danger area? Because sometimes what can happen, that blood or pus can accumulate in this area. So if blood accumulate in this area, it can freely, you can say, tends to collect in this area. Now this blood collection, see here in the diagram, so I will show you in the diagram. So this is your loose aponeurotic, loose connective tissue, and if the pus collected here or blood or bleeding collected here, so please remember pus can go through these blood vessels. These are your emissary veins which I am highlighting in red color. See here all students, these are the emissary veins which are draining into these dural venous sinuses. Okay, so pus can collect into this danger area of the dangerous area of the scalp, and now it can travel from the extracranial region into the intracranial region through these emissary veins, and now the infection can enter into these dural venous sinuses and it can lead to thrombosis also, infection and thrombosis also. So that's why it is known as danger area of the scalp. So please remember, whenever there is any blunt trauma to skull or scalp, these emissary veins, these veins which I am highlighting here at the moment, these are the emissary veins, these are valveless veins, and they are draining, you can say, the venous drainage of the scalp from the layers into the dural venous sinuses. Now what happened, due to blunt trauma to skull or scalp, these emissary veins sometimes can also rupture. So when they can rupture, the bleeding will accumulate, and that there will be extravasation of the blood also. That extravasation of the blood will not go into the side, it will go into the around the eyes, and it will develop what, it will develop black eye in the patient. So two important clinical scenarios in relation to this loose connective tissue. Number one, Number one, if there is any, this loose connective tissue, please remember this loose connective tissue, it is your danger area of the scalp. Okay, it is your what? It is your danger area of the, or dangerous area of the scalp. And sometimes what happen, because the pus and blood can freely tend to collect into this area. So if there is any pus collection in this area, please remember it can travel through these emissary veins into the dural venous sinuses, and it can lead to thrombosis. Okay, fatal thrombosis in the patient. So see here, so the infection from the extracranial part will enter, infection entering into the intracranial part. Okay, so this is very important, one clinical correlation. Second clinical correlation, if there is any blunt trauma to skull or scalp, these emissary veins, these ones, which I am highlighting here in blue color, red color. Okay, so these emissary veins can rupture and it can drain. Okay, and when they can rupture, there will be extravasation of blood in this area. Okay, so whenever there is extravasation of the blood, please remember it will not go to the lateral side, because on the lateral side of the skull it is attached with the superficial temporal fascia attached, so it will not go there. It will not go to the posterior side, because on the posterior side the occipital muscle of the occipitofrontalis aponeurotic tendon, it is attached to the superior nuchal lines. So blood will tracks anteriorly and it will encircle the eye, and the patient will develop what? Black eye. Okay, so now for example in this picture you can see here, this is the occipital belly of the muscle, this is the frontal belly of the occipital front, and this is your epicranial aponeurosis. So epicranial aponeurosis, it is your which layer? It is your third layer. Okay, third layer. First layer is which one? First layer is skin, second layer is dense connective tissue, third layer is your epicranial aponeurosis. So this is your third layer. Fourth layer is your which one? It is your loose areolar connective tissue. Okay, and fifth one, it is the pericranium. Okay, so now see here, now we are going to draw this diagram ourselves now. So first of all, see here, this is the skin layer, number one. Number two, this is your second layer, that is your connective tissue, which is your dense connective tissue. Third one, this is your aponeurosis. Aponeurosis of which muscle? Occipitofrontalis muscle. I am going to write it as occipitofrontalis, OCF, frontal belly of occipitofrontalis and occipital belly of occipitofrontalis. Okay. Fourth layer, it is your loose areolar tissue. Loose areolar tissue. And fifth one, it is your periosteum. Periosteum. Okay. So periosteum it is, and now here under the periosteum, see here, this is your skull bone. It is a flat bone. Flat bone containing the bone marrow. That bone marrow, it is known as diploid. Diploid. Okay, like this. Now see here, skin. After the skin, then you have this dense connective tissue layer. This one, second one. Okay, so this dense connective tissue contains what? It contains arteries, veins and nerve fibers. So it contains artery, veins and nerve fibers. So the neurovascular bundle, it is present here. Okay, then this is the aponeurosis, third layer. This is your third layer. On one side it is the frontalis muscle, on other side it is the occipital muscle. And now it is making here the third layer, that is the epicranial aponeurosis, or also known as gala aponeurotica. Fourth one, this is your fourth layer, loose areolar connective tissue. Okay, now see here, now here you have the meninges. So this red one now which I am drawing here, this is the periosteal layer of dura mater, and this one which I am drawing here in green color, this is the meningeal layer of dura mater. Meningeal layer of dura mater. And in between these two layers, you have these channels, valveless channels that are known as what? Dural venous sinuses. Dural venous sinuses. Now you have these emissary veins. See? And these emissary veins are draining the blood into these. This is this green one which I draw here. This is your emissary veins, which is draining the blood from your second layer. Okay, because all the neurovascular bundle which is giving blood supply to the scalp, it is present in your second layer, dense connective tissue. And if there is any trauma occurs here, there will be profuse bleeding and it will not be stopped by you. It is very difficult to stop. First three layers together are known as scalp proper or surgical scalp. Okay. Then see here, this diploid which is having the dura mater, it is also having some small veins which are draining the blood of the bones into the dural venous sinuses. These are known as diploic veins or diploic vessels, so which are draining the blood into the dural venous sinuses. Okay, so this is your whole, you can say, the anatomy of the dural venous sinuses. Okay, see this diagram once again. So this is your emissary veins, which are, this is your dural venous sinuses. Now they are draining into the dural venous sinuses. This is your bone. These are the small channels that are known as diploic veins, which are also draining into the dural venous sinus. Please remember, diploic vein and your emissary veins, both are valveless veins. They don't have any valves present in it. Okay, so this is your anatomy of the scalp. Now coming into the muscles of the facial expression. So there are a lot of muscles, and how you are going to remember it, so we must have to divide these muscles into various parts. For example, number one, muscles of the scalp. So muscles of the scalp, you have to remember one only muscle, that is your occipitofrontalis muscle. This is your frontal belly of the occipitofrontalis muscle. This is the occipital belly of your occipitofrontalis muscle. Okay, first this one. Second, we must have to know the muscles of the ear. So second is the muscles of the ear. So as you can see in this diagram, one muscle here, one muscle here, and one muscle here on the back of the ear. So three muscles you have to remember: auricularis superior, auricularis anterior, and this one, third one, that is the auricularis posterior. Okay, so three muscles of the ear you must have to remember. Now muscles of the eye. Muscles of the eye. Now see this muscle here around the eye. This is known as orbicularis oculi. Oculi, eye, so it is covering the eye, so it is orbicularis oculi. Second muscle which you must have to remember, this one, corrugator supercilii. Corrugator supercilii muscle. Two muscles you have to remember. Okay, two muscles you have to remember. See, this is the whole muscle which you must have to remember. See here, orbicularis oculi and corrugator supercilii muscles. Or orbicularis oculi, it will help you to close the eye. Corrugator supercilii, it will work you into help formation of the vertical wrinkles of the forehead. Okay, if you want to raise the eyebrows, you are going to use the occipitofrontalis muscle. Now the muscles of the nose. Muscles of the nose, there is procerus muscle or procerus muscle. This one, this is the procerus muscle. Second is the compressor naris muscle. This one. And third one, it is the dilator, which is going to dilate your nostrils. Dilator naris muscle. Okay. Dilator naris muscle. So three muscles you can remember. Compressor nasi. These are the muscles of the nose. Muscles of the nose. Compressor nasi, dilator naris, and procerus muscles. Okay. Now coming into the muscles of the oral cavity or the mouth. So for the muscles of the mouth, please remember there are lots of muscles of the mouth. So we will draw here one diagram with all of you together. See here, for example, if this is the mouth, this is the mouth. So this mouth, it is covered here by this muscle. This muscle is known as orbicularis ori muscle. Number one. Second muscle, one muscle which is going to lift it upwards like this. So this will be your levator labii superior muscle. One will depress it downwards. So it is depressing downwards, so it will be depressor labii inferior. Okay, like this. Then see here, one muscle are here pulling it to the one side of the mouth. So this is known as levator because it's present at the angle of the mouth. Levator anguli oris muscle. Same here. One, it is going to depress the angle of the mouth. So this is known as depressor anguli ori muscle, या oris muscle. Okay. Now see here, two more muscles are present here in the center. This is known as mentalis muscle. Okay. And then on the side you have one small muscle here and one large muscle here. It will be present on this side also. I am making here the diagram only from the one side. So that small muscle is known as zygomatic minor muscle. Large muscle, that is known as zygomatic major muscle. Okay. Along with this, you have to remember two more muscles, buccinator muscle and rhizoris muscle. Okay. So this is how you can remember the muscle. See here, orbicularis oculi, orbicularis oris muscle 1, levator labii superior, levator labii superior, zygomatic minor, zygomatic major, levator anguli oris, depressor anguli oris, depressor labii inferior, mentalis muscle, buccinator muscle, rhizoris muscle. So all these are the muscles of the facial expression. Please remember, all these are innervated by the facial nerve. All these muscles are innervated by the facial nerve. Okay. So this is your today's topic of muscles or anatomy of the facial muscles and anatomy of the scalp. Okay. I hope it is clear to all of you.